All right, I'm Ginille. I'm a cosmetic nurse practitioner. I've been injecting Botox fillers since 2013. We've got 2 locations in Los Angeles, JASI Skin and Wellness, and we've got 1 in Las Vegas. I am opening up clinic this morning. My team is about to get here. We start seeing patients shortly. If you have questions, jump in. We can go through them. I can talk through treatments that we offer in the office. I can talk through patient before and after photos and showcase some of the patients we've seen. I can talk about treatments I have done. So anything on your mind, let me know. Also, people will jump on here and we can do your consults on live. So if you want to jump in the chat or on the screen with me, we can go through questions. In general, so this is our office. I can show you around the clinic. So this is our office in Mar Vista in Los Angeles. So 2 in Los Angeles, we have Torrance, and then we have Mar Vista. So this is a clinic, JASI Skin and Wellness. We just updated the name from Ginille Beauty. So I am Ginille, but we have a whole team of providers in Los Angeles as well as in Las Vegas. And so I was like, it's no longer Ginille Beauty Aesthetics, it's our team. We have our skincare line, everything we do in the office, safe for all skin types, all skin tones. Oh, see, I need to update this. This says Ginille Beauty. Safe for all skin types, all skin tones, and we are really focused on natural looking aesthetic outcomes. These are just some of the patients that we have seen, and they've allowed us to share their before and after photos. I can talk through any of these patients and treatments they've done. I can talk through our JASI skincare line. This is going to complement treatments that you are getting in the office, help extend the longevity of your treatments, and help you have better outcomes. In our office, so we do a lot of skin health. We have Aerolase laser, we have BioRePeel chemical peel, HydraFacial, and SkinPen microneedling. Again, all these treatments are going to be safe for Black and brown skin. We see everybody in our office. We see all skin types, all skin tones. And the laser is wonderful. We're going to be starting that up and zapping it very shortly for our patients as we start clinic here in a few minutes. That is going to be great for acne, fine lines, pores, dark spots, hair removal, and there's no downtime with it. So patients love that. We have the BioRePeel chemical peel. I just did it yesterday. My skin is glowing. I don't have anything on except some sunscreen. It's not even tinted sunscreen. And I always feel like whenever I do the chemical peel, I just have the glassiest of glass skin. So that is BioRePeel. No downtime with the chemical peel. You can combine it same day with the laser, with microneedling, SkinPen microneedling, with the HydraFacial. Depending on your skin concerns, that kind of determines how we are going to be using that chemical peel. My favorite way is to do it with the HydraFacial. So that's like deep cleansing of your pores, and we're infusing hydrating serums, and then we're putting the chemical peel on as well. That I feel like my skin is just hydrated and extra glowy. You can do it with the laser. So if you have more concerns with redness, acne, or hair removal, you can go laser wise. Or texture, if you want to go more aggressive, that's when we can put it for SkinPen microneedling. Sorry, I'm just SkinPen microneedling if you're working on like acne scars and textures and wrinkling. Okay, let me make sure I didn't miss any questions. If you have questions, please let me know. If you want to jump in, we can talk through any of your concerns. I just moved to LA this year, wanting help. Oh, thanks so much for the love. I hope you're doing great. I appreciate that. I want help with my skin and smile lines. So for skin, we have an entire membership program, and this kind of outlines it, but we allow you to come in on a monthly basis. It's $3.99. You come in monthly, and then we do one of the skin treatments that I was mentioning earlier. So we have the Aerolase laser, SkinPen microneedling, BioRePeel chemical peel, or our HydraFacial. So you pick one of those as your core treatment for the month, and we do that treatment. We really are going to customize it based on your skin needs and your concerns, and it may change from month to month depending on what is going on and the time of year and if you have downtime or not. If you want to stack those treatments, so as I was mentioning earlier, you can combine these skin treatments. A lot of people will do multiple treatments, 2 to 3 in one day. So they can be used together, depending on your concerns. So if you want to combine them, it's $250 to add on a second treatment. If you want to do your neck and chest, that is $250 to add on that. And then you can also do the natural filler. So that is probably like the most commonly performed procedure we do in the office besides Botox. But the natural filler, let me walk back and show you. This is a filler made completely from your own blood. We draw blood from your arm. We spin it in the centrifuge. We separate. So this is a centrifuge here. Actually, I should probably turn this on. My team is coming here in a minute. This is the spinner. So it's going to separate out your growth factors, your stem cells, your platelet-rich fibrin, platelet-rich plasma. From there, after we spin it, we're going to put it in this heater, and it's going to heat it and make it into a gel. And then we put it into a cooler, we cool it off, and we inject that in the face. So nothing is mixed inside the tubes. Let me see if I have the tubes here. There's nothing mixed inside the tubes. It's all made completely from your own blood. So these are empty. Nothing is in there, so there's no additives. For people that don't want filler, or they're not candidates for filler, or if they're really trying to work on collagen simulation, we can do the natural filler. Wherever we inject it, it's going to make new collagen over time. And so patients really like that because they see themselves aging backwards. They're getting healthier as they're getting older, and their skin health, and they're noticing they really like to do under eye smile lines. So the depth of the lines, the depth of the hollowness is just not as severe when we're doing the natural filler. So that you can do in the membership at a discounted rate. It's $9.50 a session as opposed to $25.50 for 2 sessions. Okay, let me see if is that Sculptra? So it's not Sculptra. Sculptra is another type of collagen stimulator. That one it's just not made from you. So the natural filler made completely from your own blood. Sculptra, if I remember the code to open up over here. Oh, I don't know. Let me see. My team will be here in a minute. Sculptra is an injectable that comes from a company, but wherever we place that, it will make new collagen. Dang, I don't know the code to my own office, guys. That's bad. I do know it. I just can't think of it right now. Let me see. I have texture issues from acne scars. So Sandy, for texture issues, we're going to really want to be thinking about SkinPen microneedling. This is a SkinPen. We connect a tip to it, a sterile tip of needles. We numb your skin so you don't feel anything. And then we clean you off after you're numbed. And then we go on here. It's like electronic, and it goes zzz. It'll feel like little slight vibrations, but what we're doing is creating controlled wounds in the skin. When your body senses those wounds, they're going to come back to repair itself. And so that is going to help with scarring and textural concerns. You can do this the same day. You can combine it with the laser. So we do the laser first, and then the microneedling, and then the chemical peel if you want to be the most aggressive. But even this on its own works well. The microneedling on its own works very well. Sometimes once people have done, treatments, we see how they respond. If you want to up it a notch, that's when we can start going more aggressive. The more aggressive you are with your treatments, the longer the downtime, but the faster the results. We want to get fast, but safe results, especially because we work on all skin types, all skin tones. So everything we do, I've treated on every color of the skin, and it works well. We just want to be mindful that you're really following the pre-care and the post-care. So this is why we do consults. I like to get on here. I like to educate. I like to do virtual consults. My team does virtual consults, in-person consults. We want to make sure that you are prepped for your treatment. You're not just coming in and not knowing what to expect with it. You haven't done your pre-care and post-care. So that's why we'll talk through all of it before we just come in and do this treatment. What is Dysport? Hi, Brenda. Dysport is, I have this all locked in my cabinet over there. Dysport is another form of Botox. It's another brand. So that is where you can use for frown lines, horizontal forehead lines, around the eyes, bunny lines, chin dimpling, TMJ symptoms like clenching and grinding, neck bands. So it's going to weaken the muscles from flexing so hard. When the muscles are flexing hard, that's when people will notice they're getting expression lines starting to etch in on their skin. And so it's a way to just smooth those out. It's another brand. That company that makes it is called Galderma. They also do the Restylane line of fillers. So there's different products that are FDA approved for use in the United States. We use different ones depending on the patient, their concerns, their goals, all of the things. So that is Dysport. We use it in our office. I love it. I have it in my face. I think it's great. Yeah. Hey, kid. I hope you're doing great. And let me see if there's other questions that I've missed. I'm just trying to scroll through here. Can you use HSA? We don't have, oh, do we have HSA? I think I registered that for our clinic. HSA only for certain treatments, if we get like for medical approval. So sometimes for migraine, Botox, hyperhidrosis. So that is for like underarm sweating, excessive underarm sweating. There's like a few things that we can do for HSA, but in general, most of the stuff is cosmetic. The acne scars might be able to pass. Okay. If there's other questions, please let me know. I'm trying to scroll through here and make sure I didn't miss them, but I'm Ginille. I'm a cosmetic nurse practitioner. I've been injecting Botox fillers, doing skin treatments since 2013. I have 3 medical spas. 2 are in Los Angeles. 1 is in Las Vegas. We see all skin types, all skin tones in our offices. This is me almost 11 years ago, before I had any skin treatments. And this is me now. And I've done all the treatments, anything that I've talked about in the office, anything that I perform, I have done on myself multiple times over. So I want you guys to know that. Skin tags on the neck, Paulina asked for. It depends on how many. I think it's 250, and you can do it either with a laser or we have a bifurcator. And you can come see our dermatology nurse practitioner, Niani. She's excellent. Do I do injector training? I used to. Like, if you have questions anytime for anything, please reach out to me. I never want to leave you hanging. Right now, it's hard for me because when I do training, I really want to when I do anything, I want to give it my 100% all. And I just I can't do that because I'm working so much with our own team of providers. But if you have questions on anything, please let me know. What was your routine or treatment at age 28? At age 28, I was struggling. I was breastfeeding a baby, my first of 3, and he was sucking the life out of me. And so this is before, I honestly don't know because I wasn't really doing much treatment. I thought back then, oh my gosh, I'm young and I'm so cute. I just loved it. And then I started seeing my face change after that baby, and I really did not like the way I looked so hollow. I started getting really bad cystic acne, like hormonal acne. So that was a whole nother thing, like in my late 20s and early 30s as well. So I had to switch it up. So what I do now, I am 38 years old. So this is 10, almost 11 years later. My oldest is turning 11 in a couple weeks. So now, like, if I would have known what I know now, I would have started earlier. But sunscreen at the bare minimum, use it every day and reapply it. I really love our JASI sunscreen. We have 2 in the office. So we have a tinted one and we have a non-tinted one. I love them both. I keep both of them on me all the time. I like this tinted one. It works great on black and brown skin. It doesn't look like you have anything on, but it gives you a really pretty glow. And it's hard to find like a tinted one for brown girls sometimes. So these are both excellent. So like at the very least, if you're doing nothing and if you're 20, even my kids, you can see their sunscreen stains in my car with their little hands. Like, making them use sunscreen is going to be so protective of your skin. It's going to maintain your skin health, help protect against signs of aging like dark spots, fine lines. So sunscreen it up. From there, use a retinoid. In our office, we do Resurface RX, and this is a retinol you can use at night. There's some buffer in there with some hyaluronic acid, so it's not so drying to the skin. Patients really like that. We also prescribe and dispense tretinoin, so Retin-A, and this is for people that have used retinol, for a long time. If they're like, I've already been using retinol, my skin tolerates it well, we can do a prescription strength retinoid, and that's Retin-A, and they can use that. So start that a few times a week on your skin with a moisturizer. I really love it with our Recovery Boost. So this helps fight against any skin irritation, any redness, any dryness, flakiness. So you can put that with your retinoid. I use this on like open wounds after our skin treatments. I use this on my kids if they have cuts. So anytime you have acne, any skin inflammation, irritation, use that. So that's a very basic, at the very, very least, doing that in your 20s. Your sunscreen, your retinoid, moisturize. But those 2 are the main ones. And then from there, depending on what your concerns are, if you want to start doing skin treatments, if you have skin concerns like acne or dark spots, we want to start those a little bit earlier. We can work really well with the Aerolase laser for treating acne, hair removal. My team is starting to come in. And let me just check some checking messages. Acne hair removal you can do with the laser. If you have dark spots, this also works well, and there's no downtime with it, and safe for all skin types, all skin tones. Yes, the $150 skin consult goes towards your treatment if we do our consult, and you do treatment within 3 months from the time we do our consults. Also, if you want to ever jump on here, patients can jump on here, and or people can jump on here and go through their questions. And so we can do that here on live. So skin treatments, in your late 20s, I think are good. If you're like, oh, my skin is good and I'm just trying to maintain, or like just be about it and I don't have any specific skin concern, the laser is really nice. The chemical peel, and I would say doing that a couple times a year if your skin is already healthy and we're just trying to maintain it. A HydraFacial if you have an event and you need to like deep cleanse the pores and you want to have beautiful hydration and beautiful glow come in on your skin. Okay, let me make sure. I'm convinced sunscreen keeps my skin congested and breakouts. Don't know what to do. Find one that you like. And I think that's the biggest one. You might have to test some of them out, and then really making sure to cleanse the skin at night. I have a microderm scrub that I like to use multiple times a week just to like really clean everything off on the skin. And it's an AHA, BHA cleanser. And so that helps me to just really feel like everything is off. Okay. In late 20s, early 30s, if you start seeing like expression lines, you're getting like the little fine lines around the eyes or the forehead or in the frown, that's when you can start doing some Botox. At that age, usually focusing up here is good, unless you have something like TMJ symptoms like teeth clenching, grinding, jaw pain. That might be when you're looking at treating your masseters and your temporalis muscles. But I think just a little bit of Botox in the late 20s, early 30s, that will keep you looking fresh, and then really focusing on skin health. Now, once you get into mid 30s, that's when we can start talking about collagen stimulators and thinking about the natural filler. So I showed you guys that one earlier. We draw blood from your arm, spin it in the centrifuge. It separates your growth factors, your stem cells. We're going to make a gel out of it by heating it and cooling it. We can inject that in the face. Wherever we inject it, it's going to make new collagen. This is great because we keep losing collagen starting in our mid 20s. We continue to lose it. And so collagen is what, I gotta get ready to go start patients shortly, keeps the skin looking youthful, bouncy, and we're losing this as we get older. So people start noticing like, oh, I got this line in my cheek, my smile lines are getting deeper, the corners of my mouth are getting deeper. So I think if you start early with the natural filler, I have a lot of patients that just never end up wanting to get filler or needing to get filler because they're able to start early and maintain that collagen. Okay, let me check these questions. Repeat that on treatment. At 24, do you have any recommendations? Yes, so those are the ones I was going through. Sunscreen, retinoid, your skin treatments in you're 24. So sunscreen, retinoid, like skincare is going to be the biggest thing for you. Later 20s, that's when we can start bringing in skin treatments, depending on if you have skin concerns, which one kind of will drive us. And then as you start getting into your early, like 33, 35, that's when you can start looking at your all natural filler. If you have gone through like, I lost a bunch of weight, I've had a lot of people like that are losing weight actively from being on GLP-1s, Ozempic, Zepbound, those things, then you might notice changes on your face sooner rather than later because we're losing fat in our face when we start losing weight. And so that is when we might be looking at doing some of those skin treatments and for like collagen and the natural filler. Okay, if you have questions, please, you can call or text our team. That way you can DM me, but sometimes I miss them because I'm about to start a day full of patients and I won't be able to be on here. But if you text our team, I see all those messages that go through as well. We can set up time to consult. You can send your pictures there, but most people will do a consult so we can go through questions, goals, tips on what to expect, how to prep for treatments, and just so you can know what to expect when you come in and be prepared for them. I can't get rid of blemishes. I use everything. Sunscreen. Are you doing that? And that's a big one because you don't want to get dark spots. If you have blemishes and you get sun on them, they're going to get dark spots and it's hard to treat pigment on black and brown skin. So that'll be the number one. Blemishes, let me know what you're using in and then if you've done benzoyl peroxide wash, if you've done like clindamycin, tretinoin, if you've done those sort of things, even spironolactone orally, if it's like hormonal, I don't know, everything from this one sentence. That's when we can also look at the laser. Aerolase laser works excellent for treating acne and blemishes. So I love that one. I would say plan to come twice a month for about 2 or 3 months. By month 3, people are like, I'm not breaking out anymore. Or if they're breaking out, they're like, I have one, and I usually have a whole face full of them. We can also do that with the chemical peel, but I think the laser works excellent for acne. Okay, let me see. How much is all natural filler? So Joanna, we do it in 2 sessions. The 2 sessions cost $25.50. It covers both sessions, the $25.50. We spread them about a month apart. And so we typically, when we draw your blood, spin it, take out, make a gel from your growth factors and stem cells, we get about 5 syringes worth of your natural gel. And we can use that anywhere in the face. Commonly, people like to use it under eyes and into the smile lines. But I have people that will, sometimes they double it. They're like, I want to do extra. And then they'll do like their temples, their smile lines, everywhere, the eyes, the chin. Like we can do facial contouring with it as well. So yeah, I can hear like patients are getting here, guys. So I'm gonna have to get in a second. Thank you so much, Couture, saying I look like I'm aging and reverse. I appreciate that. That is when I was 28 and I am 38 now. I have 3 kids. This was after my first. I have 2 more and I'm still breastfeeding this baby right now. So yeah. Which retinoid? I love our JASI Skin Resurface RX. If you've used a retinol for a long time, then you can look at using tretinoin and we can prescribe and dispense that in the office like a Retin-A. What is the causes for forehead congestion and dryness with normal clear cheeks? So it could be, are you wiping makeup off? That's one thing. Or product on the skin, like from your hair. So that could be something. Or hats. Sometimes the boys are like, it's all up here. And I'm like, oh, but you're wearing that hat. So think about those things. Also, simple things are change out your pillowcase, sleep on your back, clean your makeup brushes. I don't even want you wearing makeup, guys. Like, honestly, the girls in our office don't wear makeup. Like their skin is just skinning. And that's what the goal is. For like our patients that come in, you can wear makeup if you're trying to go out and be cute or whatever, but on the day to day, like, no, our patients are going to wear some sunscreen and call it a day. Like that's the goal. Okay, let me see. Can I do a pop-up in NYC? I need to get my license over there. I am licensed as a nurse practitioner in a few states, but not in New York. But I get New York people asking every day, and I see a lot of patients from there as well. What's better for under eye bags, lines, lasers? Under eye bags, lasers, and fillers. Okay, so if it is depth, if it's hollow, that's when we're going to be thinking filler or the natural filler to lift. If it is, when I have a big eye bag, like it's kind of protruding forward, that is going to be surgery to take it out or to like tighten it. And then it might be filler or to like camouflage it. So it really depends. You can't do filler if you get really puffy under your eyes, if you cry a lot, if you have bad allergies. Anybody that retains a lot of water under their eyes, not good candidates for under eye filler. Okay, let me see if there's other questions. What is a natural filler? That's the one we make from your blood, from your blood draw. And we take out your growth factors and stem cells, we heat it and cool it, and so it makes a gel, and we can inject that anywhere in the face. I've been doing it for the past 2 years because I've been breastfeeding a baby and I can't do regular filler, but I've done my under eyes, my smile lines, my cheeks. I've done everywhere on my face with it. My temples I really like, my chin, like any spot where I've noticed like signs of aging, which is the same spots I've used filler in the past. I just haven't had fillers for the past 3 years because of being pregnant and breastfeeding. So the natural filler works. It is not as instant as a result as you can get with filler. However, it gets better over time because it's making new collagen, whereas your traditional hyaluronic acid fillers are not making new collagen. And it's made completely from you. So a lot of people like that. I want a slimmer nose. So for noses, we can do a few things. If it is like, oh, my nose looks wide because my nostrils are flaring, you can do Botox here to minimize the flaring. If it is, like filler is not going to tighten your skin and make it super tight on the nose, but what it can do is build up along the bridge and create a highlight. So then people will tell me, oh, like because I have a bridge, my nose looks thinner. So we can do that with filler as well. And we do that on all skin types, all skin tones, all women of color, men of color, and like their nose can look smaller. If your nose is really, really wide, really bulbous, it's not going to, again, make it super tight and pinched in the way surgery can, but it can create a highlight and a bridge. So that's when people feel like, oh, it looks like I contoured my nose, and they like it. And it doesn't take that long to do. There's no surgery with it. Yeah, and it's been last a long time. I tell patients 1.5 to 2 years. Oh, I think I have photos I can show you. Sorry. 1.5 to 2 years for their filler to last, but most people come in at the 2-year mark and their nose still looks excellent. I'm just trying to scroll through here and see. Oh, here's a nose filler from the front. So Again, this is where I was talking about the highlight on the nose. So you can see more of the light down the center, building up the bridge, so it can look thinner. Now, if you want it to be more pinched in and tight, that's where you're going to consider surgery. Let me see if I have also for the nose, you know, for somebody that like when they smile, they have a bump or they want to make the tip lifted, you can do that. So you can see before it was curved down, after it's curved upwards when she smiles. This is all done with filler. This is another girl that wanted like to camouflage the bump and she wanted her tip to be pulled upwards. You can make it straight, you can make it pulled up. This girl just wanted to make it straight. So there's different things. Those are some noses that we can do. And I can just flip through these pictures really quick and I will also make sure I'm not missing any questions. Where are you? I am sitting in one of our patient rooms, about to start patients right now. I have 3 locations. I've got 2 in Los Angeles and I've got 1 in Las Vegas. I've got a team of providers. We see patients of all skin types and tones. We really focus on natural looking aesthetics, natural outcomes, with non-surgically. Okay, what's better for eye bags? Oh, I think I said that one already. That's what I need. Which one is it? Goddess Stella, I don't know which one you need. Tell me, and I can talk to you more about it. These patients are people that have done skin treatments and Botox fillers with us. And again, we treat all skin types, all skin tones. We want it to look like you. We want it to look fresh, never overdone. It's going to look rested. We can make somebody look more masculine, more squared out if we want. Here we camouflage her under eye bags. Another one that we camouflage the under eye bags with filler. So I can do filler on these people because they tell me they don't get puffy, they don't swell, they don't have a lot of water retention. So that's where we can use, whoa, I don't need to be bigger at the photos. So that's where we can use traditional filler. Okay, I'm trying to make it so you guys can see these. Let me keep flipping through these before I get ready to go. The nose filler turned up and down. I don't mind how wide it is when I smile. So then that's where we can like change the angle of the tip of the nose. Under eye filler, smile line filler. We've done, this is full face. We've done cheeks, lips, jawline, chin, corners of her mouth. And just looks fresh. Smile lines, looks like her. That's the whole point. Somebody that wanted to make the jawline more defined, more masculine, more square. They wanted it a little bit extra. You can do that. Here, I told her, you know, she felt more self-conscious about her bump. I'm like, no one sees your bump, but she felt it. She didn't like it. She wanted her nose to be straight and she wanted the tip to be very slightly turned upwards. She did that. This is the lower face. She felt like her mid face features more highlight on her cheeks and then the lower face kind of set back. So we did some filler into the lower face to bring forward her jawline. And she just looks natural and fresh and great. Here we worked on starting some skincare and so helping with some of the sunspots. And then we did some Botox around, I'm trying to make it bigger. Botox into the lines on the forehead and the frown lines and around her eyes. She still looks fresh. Yes, she has a face full of Botox, but you wouldn't be able to know. She looks happy. She can move her face. That's the whole point. Oops, sorry guys. Let me see if I can flip through a few more photos before I check in with her team. Okay, this one's all over. She's so beautiful. She did under eyes to camouflage the under eye bags. She did a little lip filler and then, and when we did this, it also ran a little bit into her cheeks. And then she did some chin filler because she wanted it to be more round and less square along her chin. And then, let me see some more. Here, she'd lost 100 pounds and she felt like her face looked droopy. So we did some filler into her mid face. We did some into her chin to make it more of a heart shape. And then we did a little bit of lip filler. This looks a little swollen right now because she just finished, but it swells and then it settles. So she looks fresh and we're trying to create that highlight to be up. Here, she did some filler into her lower face to elongate her jawline so her chin doesn't sit back. Here's somebody that has fuller lips and she wanted fuller lips. So people were like, do black girls get lip filler? I'm like, yeah, they do. She was like, she already had full lips and her face can tolerate a fuller lip. She says, I want brat doll's lips. I said, okay, so she got that. Here's somebody with a thinner lip, still maintaining the shape. We don't want it to be overdone. I'm not going to just try to shove, I can't get her shape to be exactly like this because they have different start baselines. But maintain her shape. It looks fresh. We're not trying to have it puffy above the border, so we don't want to overdo. Here, she did some filler underneath her eyes and into her cheeks and into her smile lines just to create, like, camouflage the under eye bags and just look a little bit less tired. I think I just reposted a video of her from when we did this. This was the filler on the nose. These are just some of the pictures, you guys. Like, we have like thousands of patient photos that they have allowed us to share. And so again, shout out to our patients for letting us do that. We're creating a highlight on her nose, trying to build up the bridge of her nose so it looks more contoured. And then we wanted to make the shape of her nose to lift upwards as opposed to down when she smiled. And then here's another one I've got. Patient working on lower face to elongate the jawline, and she wanted a little bit more contour along the cheeks. Oh, here's one of our nurses, Samantha. She's in Las Vegas. So we have a great team. The team is here. They're like setting up patients now. So I'm gonna have to go in a second. If you think of questions, please call or text. We do virtual consults for our patients before you come in, so we can make sure you are prepared for your appointment. We go through your questions and goals, tips on what to expect, how to prep for treatments. We do skin treatments that have no downtime to, if you want to be more aggressive, depending on your skin concerns, we can stack them and make them more aggressive. Safe for all skin types, all skin tones. We really focus on natural looking outcomes, natural aesthetics. And yeah, what's the office called? So Joanna, if you look it up right now, we just switched the name to JASI, JASI. So it's going to be new, and even our website is like finishing up. Where it has been under for the past few years has been under Ginille. So my name, Ginille, Ginille Beauty. So if you look up right now, you're going to mostly find stuff on Ginille Beauty, but I've switched it out because I have a whole team of providers at all the offices. It's not just me. So we're under JASI now. It doesn't last forever. No, none of these treatments last forever. Anything that we do here requires maintenance. Even if you're doing surgery, that requires maintenance. So we just want it to look like you. We want it to look fresh. Most people, I say 1.5 to 2 years, and we can kind of check in. Even sometimes when they come in at that point, if the filler is still holding, we don't need to do stuff. Always want to be focusing on skin health. That is going to take maintenance, just the way anything takes maintenance, guys, like our house, our cars, like everything takes maintenance. But definitely, at the very least, if you do nothing, if you don't want to hear anything I have to say today, I'm going to say wear your sunscreen. Wear your sunscreen, use a retinoid, but at the very least, wear your sunscreen. For the under eyes, we can do filler or we can do natural filler, that one made from you, wherever you feel sunken or hollow underneath your eyes to lift the skin, help light reflect off the face, and it camouflages the under eye bags. Should I stop retinoids before getting Botox? I think you're going to be fine unless you're like really, really dry or something. And because, we have to clean the skin, but you should be fine there. What's my favorite filler for under eyes? I really like the natural filler, the PRF EZ-Gel. It depends on the person. If they're really deep, I might be doing something like Restylane Lift or Voluma. If they're really thin, I might be doing Bellatero or Restylane. So it depends on the patient, how thick their skin is, how deep their bone is, what they're trying to accomplish. So I use some different ones. It really depends on the patient. How long does HA filler lasts for, and what are the side effects? So hyaluronic acid, I tell patients 1.5 to 2 years, and then we can check in and see if we should do more. Side effects, you could have bruising, swelling. Those are the main things. Safety with filler, what you want to be mindful of whenever we're doing filler anywhere in the face. What I'm considering when I'm injecting is that we're not blocking blood flow off. We got blood vessels, our whole face, our whole body. Think about you've seen the anatomy books with all the blood vessels running through. We don't want to put too much filler any spot where blood can't move like normal. So what we're looking for when we're injecting is that you don't have any extreme pain, you don't have any vision issues, your skin color is normal, not paler than normal. Any of those things could mean somehow we've blocked blood flow off, and at that point, that's when we dissolve the filler. I've been injecting as a cosmetic nurse practitioner since 2013. So going on 13 years, and I've never had to dissolve anybody in my entire career for any emergent reason. It is super rare, but you want to be really mindful when you're doing these treatments. So definitely go to somebody who knows what they're doing. Don't do too much. Like, they should know, like, they don't want to be shoving, so much filler in one spot. The more you put in one spot, the riskier it is, and it's also going to look weird. So don't overdo it. Do stuff, let it settle, reassess. You can always do more later if you want, but don't rush it. They said our Cupid's bow looks great. She's so beautiful. I love it. Yeah, she wanted to make a little bit more defined at the Cupid's bow. If you think of questions, please call us, text us. I see all the messages that go through. You can DM, but sometimes I miss them, guys, and it's never intentional. It's just I'm about to see patients since I won't be looking at this. So texting the team, I see those messages in the day. I go through all of them, but we have team members that are on the phones and responding. You can text us your photos. your questions. It's a HIPAA compliant line. Your photos aren't going anywhere. All the patients I've showed today are patients that have consented to allow us to use their before and after photos. And it is like, I appreciate them for doing that. So you guys can see what natural looking results are. It doesn't have to be overdone. It doesn't have to look crazy. That's the goal. Let me try. Oh, I keep hitting the wrong one. I can try to flip through a few more, but like, again, shout out to the patients for sharing their before and after photos, sharing their reviews. You guys can read up reviews, like search under my name, Ginille NP or Ginille Beauty. And then now everything is going to be switched to JASI Skin. How often is it recommended to do PRF? For depending what your skin concerns are. Is it your skin or your hair? We do it in the hair for hair loss. We do it in the hair for thinning, and we do it in the face for collagen stimulation. We want to do PRF EZ-Gel at least twice. You spread them about a month apart. And then if you want to do more, you can do it after that. Yeah, so at least twice, and then you want to retreat the same areas at that time. But yeah, that's for collagen stimulation. If you want to do it topically, it can help with like the healing to be a little bit faster on the recovery with microneedling. Sorry, I'm like talking and trying to flip through some of these photos before I get off. So I'm about to go see patients. We are in Los Angeles. We're in Las Vegas. We have an amazing team. I trust these girls fully with my face, and I would not get on here. I would not encourage these girls. I would not bring them in the office if they were bad. So they're awesome. Excellent providers, and so thorough. You're going to be here and feel safe, seen, heard, beautiful. Like, that is what we stand by. If you have any questions, please let me know. All right, Sally, I appreciate you. Thank you. God bless you. It says, Brooks said you're trying to book on the website. Doesn't allow me to book a consult. Then do text the number. My team, so we have Mackenzie and Akira that run the phones, and I will look through all the messages today, Brooks, but please text the number and they will help coordinate it for you if there's anything weird going on the website. I know right now we are switching from Ginille Beauty Aesthetics to JASI Skin and Wellness. So if there's anything weird as we're switching over, if you text that number, that's the same number I've had since I've been on my own, and we have all the messages there. I appreciate you guys. I hope you have a wonderful day. I'll be in Vegas next on the 14th of November, but we have the team there seeing patients today, like as we speak. So they are there. You can come in, do a consult with them, and they're awesome. Jenna, you're amazing. I'm in LA and I'd love to come see you. Oh, amazing. I would love to see you too. Jenna, please come in. We can talk on consult. We're on National Boulevard in Mar Vista, like by the Whole Foods that they just closed, and then in Torrance as well. So those are in LA. I would love to see you. I've been doing this since 2013 as a cosmetic nurse practitioner. I appreciate you guys. If you have questions, please let me know. God bless you. Have a great day. I'll talk to you soon.